Coming up, we'll be on location at Sports and Orthopedic Therapy Services in Silver Spring, Maryland, discussing the benefits of physical therapy treatments and how they can effectively diagnose and treat pain and discomfort and restore your active lifestyle with one of this region's top physical therapists, Bob Grossman. Bob received his degree in physical therapy from the University of Maryland in Baltimore, Maryland, and has well over 35 years of experience within physical therapy, and Bob is widely recognized as this region's top physical therapist. Welcome, Bob. It's a pleasure having you on our program.
Thank you.
It's your first time, in fact, on the Top Doctors interviews. Yes. We have a lot to talk about. We have some patients of yours that we're going to speak with it later as well. And I just wanted to begin by asking you, Bob, with all your experience and your unique approach that you've been offering your patients over 35 plus years in the region, what you feel helps separate and sets your sports practice apart from the others?
There are two things I believe that make us different. One is our ability to make a functional diagnosis, which basically means that we spend a lot of time in the evaluative phase of treatment, because without a correct functional diagnosis, it's very difficult to set up a treatment plan. Right. And the second thing that I think is unique about our practice is that we see the patient. The patient is under the physical therapist care and not given to physical therapy aids to complete treatments or to do anything excluding basic modality setups and those sorts of things. So when you come to sports, what you'll see is that you're going to work with the trained physical therapist all the time.
And that's a great point and a very big point, because sometimes, if not many times, when patients go to a physical therapy practice, for example, they'll meet the physical therapist at one point, but then unfortunately many times afterwards when they're coming back for their treatments, these are aids, assistants that they're dealing with in many cases, whereas with your practice, they're actually meeting a physical therapist each and every time they come to visit.
And not only that, but we employ many different methods of manual therapy. When you perform manual therapy, it requires an evaluative process at each visit. Every time you contact the patient with a treatment technique, you reassess the patient's benefit from that treatment modality. In the State Practice Act, it actually indicates that the only individual in a physical therapy practice which can perform evaluative processes are the physical therapists who are licensed. And in some cases, you may find other practices where aides or assistants may actually be doing manipulative treatment, and it actually does not conform to the Practice Act. So in our practice, the physical therapists perform all of the treatments, which I think is of great benefit to the patient.
Absolutely. And also what you touched on a few minutes ago is another important point, differentiator with your approach that you've utilized over all these many years, and that is the diagnosis. You really go through great detail, painstaking detail, if no pun intended, to come up with the correct diagnosis and then customize a treatment plan for each of your patients that best would help them.
Yes, that's correct. The basics of evaluation have to do with incorporating a significant basic knowledge base. That being a physical therapist who's doing manual treatment needs to be an expert in anatomy. They need to be an expert in neurophysiology. They need to be an expert in biomechanics, and they need to have a good understanding of pathology. If you can bring all of those areas of basic knowledge into your practice, you got a high potential of actually making a good diagnosis. Also, I was given a great opportunity early in my career to have trained with a number of osteopathic physicians, and then I followed that up with continuing education in that area. And over the years that I've been practicing, I have found that there's a model which is called the muscle energy model of assessment and treatment, and it allows you to put words onto how the diagnosis is being made. And then those diagnostic categories are allowing you to follow through with your treatment. It's very specific, and it's identifying something called the primary somatic dysfunction. And without going into too much detail there, it's very helpful if you can identify what the primary somatic dysfunction is and how the patient is compensating for those primary somatic dysfunctions in developing a treatment plan. The other thing that I think is very important is that there really are only a couple ways that patients are maintained in this somatic dysfunction. And they have to do with either some form of scarring, fibrosis, connective tissue restriction, and or what is actually more common is what is found in a way that patients compensate for their pain pattern is by what's called facilitation or muscle spasm, or by, interestingly, inhibition. The nervous system may tone down the dysfunctional region by inhibiting muscle activity, so patients end up with a muscle imbalance.
Another great benefit that you all have been offering over all this time for your patients, Bob, is that you have not only early morning hours, but they run all the way into the evening, really making it easier and more convenient for your patients, whether they're folks in the working world, students, athletes. It's a great benefit.
Yeah, we've always felt that in our area where we practice, almost everybody's working. So when you're working, you need to find time to get your treatment, and the best time for those people that are actually gainfully employed is to come early in the morning or come after work. So
right.
Yeah, we've been available, and we've always felt that that was important.
I wanted to ask you, Bob, how do you treat these dysfunctions that you've told us about?
All right, when a patient presents with a surgical post-op condition, or sometimes postural dysfunctions can be chronically maintained. And when they do, sometimes the patient will be left with less than normal mobility in the connective tissues. Scarring, fibrosis, those sorts of terms are used to describe that. And when that occurs, and you understand that as a primary maintaining process, then the only thing that you can do that will be effective is directly stretch that tissue, which might involve things like myofascial manipulation, joint manipulations, those sorts of things. When the patient presents with the more commonly found maintaining process, that of facilitation, then there are many treatment modalities that can be used. You can still use high velocity manipulations if you so desire, but I found them to be useful in very small numbers of patients. What's most effective is to use inhibitive techniques such as counter strain, muscle energy procedures. Those sorts of things are very effective in treating these types of patients.
I wanted to ask you, Bob, what types of patient populations do you see here at the practice?
Well, we're fortunate in having a very wide range of patients. We see patients who are adolescents, athletes, college athletes, sometimes professional athletes. We see patients all the way through the spectrum of ages up through Medicare patients. We also see patients which have somewhat odder maybe diagnoses, such as patients with dysautonomia, patients who have Ehlers-Danlos syndrome, and a variety of other dysfunctions. Cervicogenic headache we treat here. All types of patients, from athletes to general folks.
So people basically, from what you just told us, Bob, of all ages, from children right on through to elderly folks, athletes and weekend warriors, non-athletes, and everyone in between could benefit from coming to a physical therapist like yourself based on their situation.
Yes.
Now, Bob, I understand that you have been teaching postgraduate physical therapists and also take interns from many of the local doctor of physical therapy programs, both locally as well as regionally. Can you please tell us more about that?
Sure. I got interested in teaching many years ago with a good friend of mine, and we found that there was kind of a paucity of clinical educational sites that were doing postgraduate education in this area. So we started to put together some talks on a variety of manual therapy approaches to treatment and whatnot. And eventually we started to develop programs to provide regional areas of assessment and treatment from the neck, the thoracic cage, lumbar spine, pelvic girdle, knee, foot, elbow, wrist, shoulder, those sort of regional assessments. And then over the years I developed a series of treatment assessments and their eventual treatment with something called closed chain manipulation, which I and others have found to be very effective in treating connective tissue restrictions where the patient has lost joint mobility.
We're now going to meet some patients of sports and Bob Grossman. Welcome, Frank. It's a pleasure to have you on our program.
I'm delighted to be here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Frank, by having you tell us what problem or problems were you experiencing that brought you here to sports and orthopedic therapy services.
In 1990, I had a terrible accident in the mountains in Virginia. And there was some doctors saying I was going to lose my right leg because of all the damage that was done to it. And I was back and forth in ambulances through the mountains. Eventually I ended up back here at home in a hospital bed in the living room where I'd have to pull myself out and crawl to the bathroom. And so I wanted to save my leg if I could, but of course I had no idea how. And I found myself here for physical therapy.
Oh, okay.
And it was extremely painful. And I happened to meet Bob Grossman. And I credit Bob with saving my leg, because not only did he know what to do as far as physical therapy was concerned, but he appreciated the psychological challenge that I was facing. Because every day when I would come here, and I was coming 5 days a week originally, I would be saying, I don't want to go, that really hurts.
Absolutely.
But I would tell myself, I'm going to go visit Bob. And his competence, coupled with his compassion,
oh yeah, there's so many.
His understanding of what I was going through, and his knowledge of what it was going to take for him to help me do what I want to do, which was keep my leg.
I wanted to ask you, Frank, what some of the treatments were that Bob was helping you through.
Well, I can tell you initially, we're talking about getting me to move my leg inches. And so, and it required a lot of courage on my part to do it, because inches in the beginning was like someone stabbing me in the leg.
Yes.
And I just trusted that Bob understood how much to move me and what. And then of course I had things like stim and heat and ice and a lot of the traditional things you would have to help calm the nerves and the irritation and the inflammation. And you know, I've been coming here for years, and so I see Bob treat lots of patients, some on my same schedule, so we become friends. Others, high school athletes, elderly people, and I can watch him work his magic.
Yes.
And the transformation in these people. And it's, he is extremely knowledgeable and extremely competent.
I mean, it sounds like you were really in quite a lot of pain and suffering and affecting your life in a major way prior to coming to Bob from the accident that you had many years ago.
Yes.
And then you started coming here. You were coming here as much as 5 times a week, you said. Initially, and really pushing yourself to in the beginning to come, as painful as it may have been.
Right.
And then Bob really factored in both the how to help you physically, but knowing the importance of the mental component.
Yes.
And
Emotional component.
Emotional
yes.
component as well.
Yeah.
And with all that being said, how do you feel today?
Well, I've got my leg.
Yes.
You know.
You look great, by the way, Frank. You do. You're smiling. I said, walking around all
Yeah.
fine and good.
Yeah. I mean, I injured my neck, and through the years, I've had to come back because when I finally did have to get a hip replacement after 10 years, this leg is an inch longer, and so from my hip to my knee, there's all this stress and trauma, and so that's brought me back some time. I hit the windshield in the accident, damaged my cervical spine. I had to deal with that. That brought me back here.
Yes.
But I know what he accomplished in that first terrible year,
Yes.
that I always feel confident coming back here.
And that's when it was the darkest, you were suffering the most, and going through a lot of issues, I'm sure, as you
I was still
mentioned,
playing
emotional.
rugby, and I couldn't walk.
Yes. And then let me ask you, Frank, how long after you started coming here to Bob initially, all those years back, did it take for you to really start realizing, hey, I can do this, and then you started seeing the results of coming
I understand
here?
your question. I don't remember exactly, but I will say definitively that it was with his help that I came to that point.
Yes.
That I believed it. I would not have believed it on my own.
Yes.
I would lay in bed sometimes and cry. It
Yes.
was just, the pain was just
That much.
unbelievable.
So probably within a few months after you started coming here, would you say, or
Well,
somewhere in that range?
yes, when I believed it could happen, and then I had to do a whole year of hyperbaric chamber therapy because I had avascular necrosis.
Oh, boy.
And we were trying to save my hip joint, which we did, but
There are multiple things going on that you were
oh yeah,
suffering
but
from.
this is where I was coming, and this is where I got my courage to go on.
Yes. Well, like I said a few moments back, you look great, you sound great. Oh, everything all these years later seems to be in place, and you just come back occasionally, as you mentioned,
Right.
to have a
If
tweak
I break
here.
something else.
Yes, or a tweak here or a tweak there, right?
Right.
All right, and before we let you go, I wanted to ask you, Frank, if there's anything else you'd like to share with our viewers.
If you have a need of a physical therapist, this is the practice you want to come to. And if you're fortunate enough to have Bob take care of you personally, then be confident you're going to get better.
Yes, indeed. And on that note, we'd like to thank you, Frank, for joining us and sharing some of your experiences and being a guest on our program.
My pleasure.
Thank you. Welcome, Trish. It's a pleasure having you on as well.
Thank you so much.
I wanted to ask you, Trish, if you could also please tell us what problem or problems were you experiencing that brought you here to Bob and Sports and Orthopedic Therapy Services?
I'm a nurse, and I developed back problems in nursing school from lifting. Had several injuries, worked for an ambulance company, and the gurney collapsed and ripped out muscles in my back. And I have severe arthritis, fibromyalgia, and when I came to Bob in 1994, I wasn't able to really walk well. I had severe back pain and bulging discs and all sorts of things.
You were going through a lot as well back then, and you, just like Frank, have been a long-time patient of Bob's.
I've seen Bob since 1994.
Yes, indeed. And I wanted to ask you, Trish, if you could please tell us, when you came to Bob, what happened initially in the beginning after you had that accident and those problems?
Well, when I came to Bob, I said, I'm having a lot of difficulty walking. And he cares about his patients so much. He listened to everything I had to say. He is very skilled with his hands in determining where things were tight, where things weren't working well, and gave me the correct exercises to stretch out the areas that were very tight. And I just can't say enough good stuff.
And how long was each initial session when you began?
At least an hour.
Okay.
And then working on the therapies or on the equipment, the stretching equipment, the treadmill, all that kind of stuff.
Oh, okay.
And then heat and electrical stimulation, and good 2.5, 3 hours I'd be here.
Total. Yes, each time.
In the beginning, yeah.
In the beginning.
Mm-hmm.
And then when did you start feeling the results and seeing the results?
I felt the results right away.
Oh.
Right away. He got things
Interesting.
adjusted the way they were supposed to be adjusted, in alignment. And, it took a long time to get everything stretched out.
Sure.
But I felt, right away, I felt different.
Well,
And every time.
Yes, indeed, and I'm happy to hear that. And have you been coming back occasionally to Bob since everything was taken care of many years back?
Yes, I have chronic issues with arthritis, and so yeah, I come back to see him periodically.
I see. And before we let you go as well, Trish, is there anything else you'd like to add?
I think his caring and his competency, the competency is beyond anything you could say. He's very skilled, very, very skilled.
Yes. Well, on that note, we'd like to thank you as well, Trish, for joining us, sharing some of your experiences, and being a guest on our program.
You're very welcome.
It was our pleasure.
Thank you.
Welcome, Marissa. It's wonderful having you on today with us.
It's an honor to be here for Bob.
I wanted to begin by asking you, Marissa, if you could please tell us when you first came here to Bob and the practice.
Okay, I came here about 4 years ago.
Oh, okay.
Yes.
And what was the reason that you came here? What problem or problems were you experiencing that brought you here?
I had elbow surgery and I had a sprained ankle as well as an elevated rib.
Oh, so you're dealing with multiple issues.
One after the other.
Oh my goodness. And were you trying to get them resolved through other means prior to coming to Bob, and the pain and the issues were still there before you came here? Is that what it was?
Well, after the surgery, I needed therapy.
Okay.
And then when other things started happening, I consulted with the surgeon, and he
Yes.
said, just go back to Bob.
Wonderful. So then you came here, and what were some of the treatments or program that Bob had you go through that helped you with that?
We did some stretches
Okay.
initially, and then he would put me through some exercises with the balls, with the chairs. He's very creative. And then, he would instruct you to go home and do some more exercises and continue that regimen throughout the week.
And initially, how often were you coming?
3 days a week, 3 hours a day.
Oh, okay. And then how long would you say after you started coming here did you start feeling some of the results begin?
I would say about 3 weeks after.
Oh, okay.
Yes, almost
All right.
immediately.
Yeah, that is.
Yes,
That is.
yes.
And do you still come to Bob occasionally?
No.
No. No
I'm
more?
very thankful for that.
Oh, so the
I come to say hello.
So everything was taken care of.
Yes.
And how long did that process take before all those issues were resolved?
Off and on about 3 years.
Oh, okay.
Yes.
So
Yes.
that's great to hear. And I wanted to ask you as well, before we let you go, if there's anything else that you'd like to add or share with everybody.
Yes, when I was coming here for therapy, Bob always made us feel very confident that we were going to be better if we just, followed his instructions, followed what we had to do. But more than anything else, it was a certain gentleness and understanding that Bob shared with you that made you feel comfortable while you were getting your therapy. I used to call it a spa treatment. I said the only thing he was lacking was a bar.
Well said. And on that note, we'd like to thank you as well, Marissa, for sharing some of your experiences and being a guest on our program.
It's been an honor. Thank you very much.
Thank you. We're now back with Bob. I must say the patients are very happy with the results and great work that you're doing here at your practice, Bob.
Thank you.
We're literally out of time, Bob, but I wanted to ask you before I let you go, you and your practice here in the Silver Spring, Maryland area of Maryland have established a reputation for excellence, not only in patient care, you're a leader in the industry in physical therapy, you're teaching folks as well and passing on your knowledge and wisdom to other aspiring physical therapists in addition to running your very successful practice here. And I just wanted to ask you if there's anything else you'd like to add before we let you go.
When you come to sports and orthopedic therapy services, you're going to be treated with respect, and you are going to receive, I believe, the highest level of care that you can receive in this area from a physical therapy perspective. Our front office staff is extremely helpful, and our physical therapists are expert at what they do. So I think you'll be happy to come see us.
Absolutely, and they're going to meet a physical therapist each and every time as well, as we touched on earlier. That is a big component of what you offer here, not to mention the extra mile, and I hate using cliches, but we've heard that from your patients. Your staff, everyone here really treats each of your patients like family, and that is not something you normally hear when a patient is in pain and they don't know who to go to and they come to you, and to have them, in many cases that of folks that we've spoken with, all say that they really felt like they were treated like family. I think that's a great component of what you have been offering and has a big part of your practice here.
Thank you very much.
On that note, we'd like to thank you, Bob, for joining us, being a guest in our program. We'd love to have you back on in the future.
Thank you.
Thank you.